Hi, this is Mary Greendale, and it's campaign season. Candidates are starting to be interviewed, and I want you to understand that when I interview these candidates, I am asking each candidate for an office the same questions. They get the questions in advance, they can prepare, and then we go through them. I have found this to be a good way to get a sense of how people respond to the questions in substance, and also how they differ between one candidate to another. The other thing, for candidates that are not opposed, I do not do interviews, but if they are brand new to town government, I do. And I do so because I believe that people have the right to know who's running their town government. And so we meet them, we talk to them, and we ask them a series of questions that's appropriate for their town office. So you will be able to watch these interviews at your leisure, and keep an eye out for them, and let's get going. Hi, this is Mary Greendale, and today I'm interviewing Jay Leary, who is a candidate for the Board of Health. The other gentleman who is running for the Board of Health has chosen not to be interviewed, so you will not have the advantage of being able to hear his responses to the questions that we ask here. But let's jump to Jay right now. Hey, Jay, good to see you.
Hello, how are you?
And yourself.
Good.
He's outside enjoying the fresh air. I'm inside. Anyway, so not everybody knows everything about you. So let's start with you. Tell us about yourself.
So my name is Jay Leary, and I am been a resident of this lovely town for the last 53 years this year. My parents moved here in 1968. I went through the Holliston school system. My wife also went through the schools. I have 5 children. They all went through the schools here. I'm a clinical pharmacist. I manage a home infusion company in Shrewsbury, Massachusetts. And I've done other public service in the town, being on the finance committee for 9 years. And I was a member of the select board for 6 years. I think it's time to branch out and do something different. And I think the Board of Health, with my skill set, I think is a good fit.
Well, the pandemic certainly put them under the microscope this year. I mean, we don't usually, there's not usually a lot of activity. It seems that most of the Board of Health responsibilities here fall to septic systems.
Yeah.
But there's certainly many, many other places in which they are involved in our lives, or could be. So are there any initiatives that you will propose to the Board of Health? What would those be?
Sure.
Go ahead.
So I was fortunate enough to be sent there in a letter, I guess a meet the candidate thing to the Holliston Reporter. And in that I mentioned 10 initiatives that I think are something I would like to see implemented. I want to make sure that the town of Holliston has the most up-to-date COVID-19 metrics. There's a lot of data out there, and it's really, really helpful. I'm a numbers person. I like numbers, and I think there's a lot of good pieces of information that one can glean from that, and I think it should be shared with all our residents. I want to make sure, particularly now with all the vaccines and all the discussion around vaccines, that Holliston residents have access to those vaccines. Particularly, I guess, having parents that are still living in Holliston that are older, a little less mobile, they got their vaccine, they had to travel to Gillette to get it, but not everybody has the ability to do that. And we need to come up with a system so people that don't have access to vaccines through CVS's, Walgreens, Gillette stadiums, we can get those people the vaccines that they also want. Obviously, seniors, I being one of them now and have been for a while. I remember a few years ago getting my senior pass to go into the senior center. There's a lot of diseases and a lot of things that affect seniors more so than younger people. We need to have situations, and we need to have programs in place to reach out to those folks and get those the quality programs that they need for that. Obviously, this pandemic, I think, caught everybody a little bit by surprise. Not only our federal government, not only the world governments. but the state and local governments too. And I don't think we were as prepared as we could have been. And that kind of goes into the next piece that I would like to do, which was many years ago when a former director of the Board of Health was here. We developed a system called HERC, which was the Holliston Emergency Response Corps. And it was a conjunction and a collaboration of not just Holliston, but surrounding communities that were going to band together to provide for situations like COVID, where we could rapidly respond. We would take the skills of nurses, pharmacists, doctors, EMTs, first responders, and kind of have a plan that if we ever had some type of situation like this or a natural disaster, we could respond immediately to that. That kind of died on the vine a little bit. I'd like to get that re-energized. So that's important. And that kind of falls into this COVID idea. The websites, I've seen a lot of websites. I've looked at a lot of websites since I was interested in running. Some of them are very interactive. I'd like to get ours. Not that it doesn't have good information on it, but a little more interactive that people could glean some good points and information on. You mentioned it earlier. I think a lot of people don't realize what the Board of Health does. The Board of Health has a lot of responsibilities, and it's not just around septic. It's around a lot of health initiatives. It gets into animal control, agriculture, a lot of things. Beaches, you know, when we go to the beach in the summertime and they say, oh, I'm sorry, we can't do it because it's closed, that's your Board of Health. So we need people to understand what that is. And I think that is something that I'd like to do. And one of our state reps, our only state rep, Carolyn Dykeman, is very big on environmental issues. I know she's chairman of the committees in the State House. We have a lot of environmental issues out here, and I'd like to work with her and the town to see some of that. I know we have a lot of, this is a right to farm community. We have this time of the year, we get into mosquito sprayings and other spraying, and it affects some of the agriculture that Holliston uses today. And I think we need to address some of those issues. And finally, I just want to set some goals that are measurable and are accountable, that if I'm elected, and I'm fortunate enough to be elected, that people can look and say, well, here's what he said they were going to do. And either they did them or they didn't. And then we can be critiqued on that. So those are my ideas for the Board of Health.
That is a very ambitious schedule, I must say.
It is.
Must say that it's a long list. So you've touched on some of the other questions that we were going to talk about, but I do want to speak to the pandemic. Obviously, that's kind of a front and center at the moment. What are the kinds of things that we might have done or that you'd like to have seen us do during the pandemic that we didn't do?
Well, I mean, I think the biggest piece is the solid communication. I think so. And again, it was thinking back when this all transpired. We didn't have good communication from the top, and it surely didn't filter its way down. I think people were confused. I think people didn't know what to do, whether it be stay at home, not stay at home, wear masks, not wear masks, whether we closed down businesses, we closed down schools, all these things. I think everything kind of happened and we reacted to it. We were reactionary. We weren't proactive in it. And I think one of my colleagues when I was in town government, Mike Cassidy, who was guy's amazing on the stuff that he knows about, planning and stuff like that. That's, I think, what our biggest takeaway was, that we didn't really have a good handle on what we were going to do next. And crises present those opportunities, and you hopefully learn from them. When I was a select board member, my biggest fear at the time was that the water in town was going to have a problem like we see on the news and stuff, and what we were going to do, how we were going to handle that. That's kind of what caused the DPW to get a lot of initiative and ultimately passed, because we needed to have professional management of a system that I sure as heck wasn't, skilled at, and nor were my colleagues. And I think something like this is going to show us when we look back at it. Hopefully we'll do a tabletop exercise with Mike or others, and we'll say, what did we do right? What did we do wrong? And I think we're going to learn a lot from that. But I think our preparedness comes out. And it's not just Holliston. I don't want to make it sound like it was on a state level, it was on a national level. And honestly, you could see even on a global level, we weren't really prepared for it. So
I know that I was around and actually served early in the Holliston PERC, was it? Is that what you call
yes,
it?
yeah,
Emergency Response Committee. I remember Lisa Jackson was the state coordinator or
yeah.
regional coordinator. But at any rate, I always thought that was such a very, very good idea. So
Yeah.
what do you think it would take to reactivate that?
Well, obviously, it's got to get the energy. We got to talk to our colleague towns, and we got to say, hey, COVID, if nothing else, it taught us this type of group, this type of organization is important, and we need to be able to hit it hit the ground running with it, and not talk about it. We need to have action. And I know we did a lot of preparation. I know I participated in a couple of tabletop exercises, but then it kind of died on the vine. And we have to keep that initiative going, because if you believe what the global national leaders are saying, this is just the beginning of probably many more down the pike that are going to come down. And we need to be ready for it, because we need to do a better job. If you think about it, this started about a little over a year ago this time. It was early March or mid-March when this happened. We're still dealing with it, and it's looking, I see light at the end of the tunnel, especially with the vaccines, but we still got a long ways to go. There's a lot of conversation. I feel bad for like the students of our town, both college students, high school students, elementary students, because the last year and a half or the last few months, 13, 14 months, they've really lost out. And we're not going to be able to get that time back. My daughter's a kindergarten teacher in Hopkinton. She says, Dad, you don't realize how these kids are going into their next grades not as prepared as they should. And we're going to see that down the road. And there'll be consequences we'll be talking about many years down the road from this. So we got to do a better job there.
Because you're you and you don't have another candidate opposing you on this particular, on the TV, that is, I don't have to ask the same question of another person. I'm going to throw you a question that I think you can probably handle that I might not do to somebody else. But the question is, so one of the issues would be, mental health and the issues that affect the kids, the teachers, the parents, and all of the rest of it. What about working relationships? Do you know if there are any working relationships with youth and family services and that kind of thing?
I think there are. I know there's a relationship with the schools. I know obviously Mike Cassidy is a good person that brings a lot of people together. I know I've been reading the meeting minutes from the Board of Health going back a year and a half or so. Schools have been involved, police have been involved. I don't know that I saw anything from Youth and Family Services, but to your point, there's a lot of mental health issues that are either directly responsible because of this thing, or will be coming up the pike that people are going to have to deal with. I think I experienced some of it in my own family and stuff, from people that were having some challenges, not seeing, their loved ones. All the holidays that were missed, that families don't normally celebrate, that they can't. Yes, there's going to be a lot of that, and we need to partner with youth and family, police, schools, and get the resources that people need. I think you see that people have said that, unfortunately, suicides are somewhat skyrocketed, and that's a sad thing. And again, it's tough out there, and we need to get the resources for people so they can adequately address those issues.
I do think that over the years, Holliston has relied on the Board of Health for septic stuff, and the world is much bigger than that. The role for this organization is much bigger, and the authority of this organization is much bigger.
Yeah.
You do really, from the health standpoint, have avenues into pretty much every piece of life.
Yeah, and if you see, I think the idea is a great one. So basically, the local boards of health are actually the eyes and ears of the actual state DPH. So they rely on data, information, intelligence from what's happening in the local markets, so they can transmit that to Boston, and Boston can make some, informed, hopefully, decisions about what is the next step. They rely on that a lot. Around the whole vaccine piece, that's really critical right now. I was very involved with that with my company to try to get vaccines for my patients and also our staff, the forward-facing staff, and it was quite an operation.
So is there one, you're talking about so many different things and so many, where are you going to start? What's that one area that you're just going to jump in on?
Well, I think I want to make sure that everybody that wants a vaccine can get a vaccine, because I think that's the critical piece right now that I can probably get a lot of leverage in. Luckily, it's changing. I think in Holliston, we're in a pretty good state. I think I saw the numbers. We're at like 30% of the people are fully vaccinated. There's a bigger number that have been at least get some doses, but I know there's a population subset that can't get it because they can't access it. And I think that's something that we want to do. And I'm thinking it's probably more a senior population. That Johnson & Johnson vaccine was really, really good, because one of the ideas that the state had was that was going to be used on people that had access issues or people that were homebound. Someone like myself, who's an immunizing pharmacist, you know what? We need to get, if I find out that Mary Greendale can't get out, but she's interested in a vaccine, I need to have the doses that I can get to her, and then I need to have the way to immunize her. And that solves a huge problem, because the people that have been really hit hard from this pandemic are people that are older and had other health conditions. So that's probably number one that I want. And it looks like, in reading some of the meeting minutes, there's been some discussion about that. So I think if I was fortunate enough to get elected, I'm working with other people that are kind of thinking along the same idea, but I want to make that happen.
Well, it's the most timely thing, certainly.
Right.
Was just you start ticking off the other things that are perhaps no less important, but just not as timely, just don't need to be done today. You have, there are relationships across town. How can you build relationships with the other departments, the youth and family service, the police department, the first responders, the ambulance, all those folks knit together?
Yeah. I mean,
how can you bring them together?
Well, one thing is you have a sit down. You know what? I have, again, I know a lot of the folks. I know a lot of the players, having been in public service before. And I know I can get them together to sit down and say, listen, let's come up with a game plan on how we're going to do this. What are your needs? How can we facilitate that? And then through working with some of those relationships, again, Mike Cassidy's, and we are so lucky to have someone like himself, his connections. Mike, this is what I need. How do we get it? And I guarantee you, we're gonna, if there's any way to do it, we're gonna find a way to do it. And I'm happy to assist him. I've known Mike for 20 years, so it's easier if knowing some of the players.
True. Specifically regarding the agricultural community, as you may remember, I have an interest in that. How do you think the Board of Health can better interface with both? You have two different populations in agriculture. You have the hobbyist, and that's not to denigrate, but it's like, you might call us a hobbyist, we got a horse, okay? Right. Or the people have chickens in their backyard or whatever. And then you've got the commercial growers, and the commercial growers have very different needs. Yeah. And as official business, of course, they operate in a different environment. So how do you see the Board of Health interfacing with both of those? So
again, I think in order to understand some of the concerns of either the hobbyists and or the commercial folks, you need to sit down with them. You need to bring them in, and you need to say, guys, what are the top three things that you need or want or think are important for you? And see where we can interface and work with them to get that happen. I'd like to be aboard, hopefully, that says yes first and, looks to facilitate working with people as opposed to, no, you can't do that. No, you can't do that. No, you can't do that. There's always ways to work around things and still keep the integrity of what the statutes are, if there's any statutes that one has to follow, which in the Board of Health, there are many. But again, to see where those needs are. I'll just tell you everybody that drives through town, where all the folks are that have beehives, because you see those signs that say, hey, don't spray here because, so get those folks in. Maybe have a conversation with the state and say, guys, this is something. I know the mosquito control project, when I worked with them with the board, select board, they were really responsive to when we had concerns or questions. They were really trying to help you. When we had issues with beavers in town, the state was pretty good with us as far as working with us. It's just finding out what the needs are and then trying to find ways to address it that, like I said, stays within the integrity of the statutes or the laws, but also accommodates those folks. You're right, commercial growers have different things, but they have needs too. And I think if you just sat down with them and said, hey, what are your concerns? What do you need? I think that would go a long way to starting good relationships and finding out what we could do to work together on stuff that's important to both groups.
Well, one of these days when you have little to do and you're just interested in Googling, I suggest you go to the Mass Department of Agricultural Resources and you will find volumes of information targeted to your communities that you're looking at, the hobbyists versus the commercial growers, and so many different brochures and so forth. We have some of the stuff now in the Board of Health that they hand out. But what we don't have is the bridge that makes sure that it then gets out to the community. So
that's important.
It is. And so the Department of Agriculture, as a former employee of said, obviously a little partial, but really you'll find that they can be a huge ally. You can get the chicken inspector to come out and talk to people about what they're supposed to be doing, because some of these things can bring diseases along with them, even though they're wonderful little things to have.
Right.
So there's a lot to it.
Sure.
But anyway, just my plug for my old department. Anyway, is there anything else that you'd like to say as a closing? Because we've about exhausted questions here. You can have the floor.
Well, I appreciate the opportunity today to speak to the residents. I'm hoping that you will give me some consideration and in the form of a vote on May 25th. Like I said, I have a passion about this town. This town has done wonders for me. My service back to that is only a very small way of saying thank you for all it's done for me. That being said, I also think being a healthcare professional, especially in light of the pandemic, understanding some of the nuances of how healthcare works, I think would be invaluable on the Board of Health, especially because that's a main focus of them. And like I said, I'm anxious to learn. I've been fortunate that a couple of former members of the Board of Health have reached out to me and said, Jay, we need to sit down and go over some stuff, which I've been very appreciative of and going to take up the opportunity to speak with them because they have a bird's eye view of what actually was what they did and what they didn't. One of them is a former healthcare, she is a healthcare professional, and the other one is a person that is not, but knows a lot about the Board of Health. So that's my next goals, is that I'm going to brush up on a lot of stuff that they're going to be able to give to me. But the main thing is I wish people get out and vote. I think vaccines are important. I think the biggest part of vaccination right now is we're coming to a head because we have to reach out to the people that have some hesitancy and understandable hesitancy, and hopefully educate them that the vaccines that are out there, while they've been fairly new, they've been thoroughly tested, and I think they offer the best opportunity for people to hopefully prevent themselves from getting a very nasty case of COVID, and getting everybody. We're going to be a lot further down the road the more folks that get vaccinated, and I'm hoping, I want to be an advocate for that. I've been vaccinated myself, so I think it worked out. I think that's where we're going to come down the pike and see when we can get to a higher level of vaccination. It's going to be good for everyone.
Hey, Jay, I appreciate you explaining yourself and what you want to do. I think it's a very ambitious agenda, and I love your ideas. I think they're really right on, great ideas. I do see a lot of work ahead.
There is.
So anyway, thank you very much for speaking to me today. And I will remind everyone that yes, indeed, the election is on May 25th. Same place as always. You can vote early. If you're curious about that, please check the website, the town clerk's office on the website, Holliston town website, and you can find out about all of that. So,
and one other thing, Mary, if I could, I always forget this. So when you see my name on the ballot, it's not going to say Jay Leary on it. It's going to say John Leary Jr. And I am one and the same. But everybody who knows me as Jay. So that's something, because I remember one of the elections, a person said, I was going to vote for you, but I didn't see Jay Leary on the ballot. And I said, that's because I'm John Leary Jr. And they said, oh, so I am one and the same. I've been called Jay ever since I've been a little kid. So, and that's how most people know me. So, but I am also John Leary Jr. So proudly.
Good point. All right, folks. Thanks for joining us again, and we'll be getting back to you soon with more interviews for this year's campaigns for local office. Thanks so much.